Patient identification means a lot to operating room nurses because it's a way that we can safely identify our patients when they're asleep.
Just as a patient, I'd like to know that I'll get the right procedure once I go through. And of course, you have the identification on you to make sure that you do get the right procedure.
So if a patient's not identifiable, then we don't know what care they require, we don't know what surgery they need, we wouldn't know what medications they were allergic to. So patient identification provides vital medical information to us about their patient consent, about their date of birth, and their hospital UR number, which links them to a record, to a patient record. So all those identifiers, especially the 3 identifiers, are essential for us. The patient's UR number, the patient's date of birth, and the patient's name, surname and Christian name. Significant risks to patients if we don't have the right identifier because we don't know what they could be allergic to. We could potentially put the wrong PrEP solution or inject them with the wrong something that would cause them harm. So mostly it's about keeping our patients safe and knowing that by doing that, whether they're awake or asleep, whether they speak English or from a non-English speaking background, that we can identify them at any time.
It shows the professionality of the staff as well to make sure they have the right person. They put your name tag on you straight away.
Okay, so when patients come into the holding bay in the operating theatre, we have a check that's already been completed with the patient on admission. So we have several other checks that we do with patients prior to them going to the anaesthetic rooms and prior to surgery. So it's vital that we have an armband, one armband that is visible and has clear indications of those 3 identifiers.
The whole, because you're moving from one place to the other, and yeah, just to ask, make sure I am who I am, the identification on me. Like I said, it just shows how professional they are, and it makes me feel more reassured.
Best practice is to ensure that every patient has an ID band all the time that they are actually in the hospital, and that they ensure that the patients are wearing them, and then if they actually remove it for clinical care, that they replace it and check the identifiers with another staff member and then pop a new one back onto wherever they choose to on a limb.
From what I've seen, I'm very happy with the whole process.